Question number 1. The most common presenting symptom of endometrial cancer is? The correct option is D. Abnormal vaginal bleeding. Question number 2. A cone biopsy of the cervix is performed in the diagnosis of? The correct option is C. Cervical carcinoma. Question number 3. Which of the following is a non-hormonal method of contraception? The correct option is A. IUD copper. Question number 4. The shortest stage of labor is typically the correct option is C. Third stage. Question number 5. When the fetal head is visible at the vaginal opening without slipping back, it is called? The correct option is B. Crowning. Question number 6. The uterus returns to its pre-pregnancy size by? The correct option is C. 6th week of postpartum. Question number 7. The most common cause of postpartum hemorrhage is? The correct option is A. Uterine atony. Question number 8. The rate of cervical dilation during active labor in Firmigravida is approximately? The correct option is B. 1 centimeter per hour. Question number 9. Amniotic fluid is primarily produced by the? The correct option is C. Fetal kidneys. Question number 10. Which of the following is used for neonatal endotracheal intubations? The correct option is A. Miller blade. Question number 11. Which of the following drug is used to prevent preterm labor? The correct option is D. Endomethacin. Question number 12. Which medication is used to promote fetal lungs maturity and preterm labor? The correct option is B. Betamethasone. Question number 13. The ligament connecting the liver to the anterior abdominal wall is? The correct option is A. Falciform ligament. Question number 14. Apgar scoring includes all of the following except? The correct option is D. Blood pressure. Question number 15. The most common cause of postmenopausal bleeding is? The correct option is B. Atrophic meningitis. Question number 16. The most common cause of small bowel obstruction is? The correct option is A. Adhesions. Question number 17. Which of the following is not a part of the rotator cuff? The correct option is C. Teres major. Question number 18. Which virus causes infectious mononucleosis? The correct option is D. Epstein-Barr virus. Question number 19. Which clotting factor is deficient in hemophilia A? The correct option is D. Factor 8. Question number 20. The most common type of renal stone is composed of? The correct option is D. Calcium oxalate. Question number 21. Which neurotransmitter is inhibitory in the central nervous system? The correct option is A. GABA. Question number 22. The most common side effect of ACE inhibitor is? The correct option is B. Cough. Question number 23. Which of the following is a bactericidal antibiotics? The correct option is C. Vancomycin. Question number 24. Which drug is used for the treatment of organophosphate poisoning? The correct option is A. Atropine. Question number 25. Which hormone is secreted by the pineal gland? The correct option is B. Melatonin. Question number 26. Which of the following bacteria is Henri's Fazitio? The correct option is B. Helicobacter pylori. Question number 27. The most potent stimulus of ADH release is? The correct option is C. Hyperosmolality. Question number 28. Which muscle is innervated by the phrenic nerve? The correct option is B. Diaphragm. Question number 29. Which hormone increase glucose uptake in the cells? The correct option is C. Insulin. Question number 30. The primary pacemaker of the heart is located in? The correct option is B. SA node, sinoatrial node. Question number 31. The end product of urine metabolism in humans is? The correct option is D. Uric acid. Question number 32. Which vitamin is required for the synthesis of collagen? The correct option is C. Vitamin C. Question number 33. Which of the following is a tumor suppressor gene? The correct option is B. TP53. Question number 34. Which structure passes through the foramen magnum? The correct option is B. Spinal cord. Question number 35. Which ion is most abundant in the extracellular fluid? The correct option is A. Sodium. Question number 36. Which amino acid is both ketogenic and glucogenic? The correct option is C. Tyrosine. Question number 37. The main storage form of iron in the body is? The correct option is C. Ferritin. Question number 38. Which vitamin is involved in transamination reaction? The correct option is A. Vitamin B6. Question number 49. A characteristic feature of diabetic ketoacidosis is? The correct option is D. Metabolic acidosis. Question number 40. The gold standard for diagnosing endometriosis is. The correct option is C. Laparoscopy.